Today, we are diving into Chapter 1, Define Ethics in Healthcare. This chapter lays the foundation for everything we will discuss in this course. It explains what ethics means in healthcare, introduces the 4 central principles that guide medical decision-making, and challenges us to think about how professionals balance values, responsibilities, and patient needs. What is healthcare ethics? Healthcare ethics is the study of moral principles, values, and responsibilities that guide healthcare professionals in their decision-making. It isn't just about knowing right from wrong, it's about how those decisions affect people's lives. Key areas include normative ethics, establishing the moral rules that should guide professional behavior, moral character, developing the right virtues like compassion and honesty, ethical decision-making, how to handle dilemmas and conflicts, professional responsibilities, the duties each profession has to its patients and society. When we talk about ethics in healthcare, there are 4 interconnected areas that shape how professionals practice. Normative ethics is the starting point. It asks the big question, what rules should guide behavior? In healthcare, this means creating a framework of moral principles like doing good, avoiding harm, respecting patient choice, and ensuring fairness that professionals can use as a compass when making decisions. But having rules isn't enough on its own. That's where moral character comes in. Healthcare providers must cultivate virtues such as compassion, integrity, and honesty. These traits shape how they interact with patients and colleagues, ensuring that their decisions are not just correct in theory, but caring and trustworthy in practice. Still, real life in healthcare is full of difficult choices, which is why ethical decision-making is so important. Professionals often face dilemmas where values conflict, like balancing a patient's autonomy with their safety or choosing how to fairly distribute limited resources. Ethical decision-making provides a structured way to weigh those principles, consider possible outcomes, and make the most justifiable choice. Finally, all of this is grounded in professional responsibilities. Each healthcare role, whether doctor, nurse, psychologist, or dentist, carries specific duties to patients and to society. These include maintaining confidentiality, obtaining informed consent, and advocating for patient well-being. By fulfilling these responsibilities, healthcare professionals uphold trust and integrity in the healthcare system. To understand ethics in healthcare, we need to start with the 4 core principles. 2. The 4 core principles. And beneficence, the duty to act for the good of the patient. Example. A doctor prescribes medication not only to treat a disease, but to improve the patient's quality of life. 2. Nonmaleficence, the duty to avoid causing harm. First, do no harm. If a treatment carries high risks with little benefit, a physician may decide not to pursue it. 3. Autonomy, respecting the patient's right to make informed choices. Example, if a patient refuses a life-saving treatment, healthcare professionals must honor that choice, provided the patient understands the risks. 4. Justice, fairness in distributing healthcare resources and access. Example, during a shortage of ventilators, justice requires decisions to be made without bias and with fairness across patients. In healthcare ethics, 4 principles stand at the center of decision-making, each shaping how professionals care for their patients. The first is beneficence, the obligation to act for the good of the patient. This goes beyond simply treating illness. It means actively promoting the patient's well-being and quality of life. For example, a physician who prescribes medication isn't just aiming to manage symptoms, but is also working to improve the patient's overall comfort and long-term health outcomes. The second principle is non-maleficence, which is often summarized by the phrase, "First, do no harm." Healthcare providers must avoid actions that might cause unnecessary injury or suffering. At times, this principle means holding back from certain treatments if the risks outweigh the potential benefits. For instance, if a surgery carries extremely high risks with only a small chance of helping, the ethical choice may be not to proceed. A third principle, autonomy, emphasizes the right of patients to make informed decisions about their own care. Autonomy respects the dignity and independence of each person by ensuring they have the knowledge and freedom to choose what happens to their bodies. If a patient fully understands the risks yet chooses to decline even a life-saving treatment, healthcare professionals are ethically bound to respect that decision even when they personally disagree. Finally, there is justice, which focuses on fairness in distributing healthcare resources and ensuring equal access. Justice is especially critical in times of scarcity. For example, when ventilators or medications are in short supply, healthcare teams must make decisions without favoritism or prejudice, striving to allocate resources in a way that is fair, equitable, and socially responsible. Together, these 4 principles, beneficence, non-maleficence, autonomy, and justice, form the ethical backbone of healthcare. They provide both a moral compass and a practical guide for making decisions that respect human dignity while balancing the complexities of modern medicine. These 4 principles, first developed in the work of Bosham and Childress, are the backbone of bioethics. 3. Normative ethics in practice. Normative ethics asks, what rules should guide healthcare professionals? It sets moral norms to help professionals make decisions consistently. In practice, this means weighing principles against one another. Example, balancing autonomy, a patient refusing treatment, with beneficence, providing what will help them. Normative ethics in healthcare is all about asking the question, what rules should guide healthcare professionals? It provides the moral framework that helps doctors, nurses, and other providers act consistently when faced with complex choices. Instead of leaving decisions to personal opinion or circumstance, normative ethics sets moral norms, principles such as beneficence, nonmaleficence, autonomy, and justice, that serve as a guide across different cases. In practice, however, these principles don't always point in the same direction. Healthcare professionals often have to weigh one principle against another, recognizing that ethical dilemmas rarely come with simple answers. For example, consider a patient who refuses a treatment that could save or extend their life. On one hand, autonomy demands that the patient's wishes be respected. On the other hand, beneficence calls on the provider to do what will best promote the patient's well-being. The challenge of normative ethics lies in balancing these values, making decisions that honor patient rights while still pursuing their best interests. By applying normative ethics in practice, healthcare professionals can navigate these tensions thoughtfully, striving for decisions that are consistent, principled, and respectful of human dignity. Moral character and virtue. Ethics. Beyond rules, who the healthcare professional is also matters. Virtues like compassion, showing empathy and kindness. Integrity, being honest and accountable. Empathy, understanding patients' emotional and psychological needs. Virtue ethics reminds us, a caring, trustworthy character is just as important as following rules. When we think about ethics in healthcare, it's easy to focus only on rules and principles like beneficence or autonomy, but ethics is also deeply connected to who the healthcare professional is as a person. This is the focus of virtue ethics, which emphasizes the importance of cultivating strong character traits that shape not only decisions but also relationships with patients. One of the most central virtues is compassion. For example, imagine a nurse caring for a terminally ill patient. The nurse cannot cure the illness, but through compassion, listening carefully, offering comfort, and showing kindness, they help the patient feel valued and less alone in their final days. Compassion transforms medical care from a technical service into an act of human dignity. Another essential virtue is integrity, which involves honesty, accountability, and moral courage. Suppose a surgeon makes a small mistake during a procedure. Integrity demands that the surgeon discloses the error to the patient, even though it might be uncomfortable or carry professional consequences. This honesty builds trust and shows respect for the patient's right to know what happened. The third key virtue is empathy, the ability to understand a patient's emotional and psychological needs. Take the example of a physician treating someone newly diagnosed with cancer. While the medical facts can be delivered quickly, empathy means the doctor also notices the patient's fear, pauses to answer questions gently, and provides reassurance. By recognizing the patient's emotional state, the doctor offers care that addresses the whole person, not just the disease. Together, compassion, integrity, and empathy illustrate how virtue ethics complements moral rules. A professional who has cultivated these traits naturally provides care that patients can trust, even in difficult circumstances. In this way, virtue ethics teaches us that good character is not an optional extra in healthcare. It is just as vital as medical knowledge or ethical principles. But even with strong character, healthcare professionals often face dilemmas. Ethical decision-making. Decision-making requires balancing competing principles. Steps usually include 1. Identifying the ethical issue. 2. Considering the relevant principles: autonomy, justice, beneficence, nonmaleficence. 3. Evaluating options. 4. Making the best possible choice. Example: a terminally ill patient requests high-dose pain medication. The physician must weigh beneficence, relieving suffering, against nonmaleficence, risking harm. In healthcare, ethical decision-making is rarely simple. Professionals are often required to balance competing principles, since what promotes one value may come into tension with another. For example, a choice that supports a patient's autonomy might raise concerns about their safety, or an action that relieves suffering could risk unintended harm. To navigate these challenges, ethical decision-making usually follows a step-by-step process. 1. Identify the ethical issue. Clarify what the real dilemma is, what values or principles are in conflict. 2. Consider the relevant principles. Draw on the 4 cornerstones of bioethics: autonomy, justice, beneficence, and nonmaleficence. 3. Evaluate the options. Think through possible actions, weighing their benefits, harms, and fairness. 4. Make the best possible choice. Select the option that most faithfully upholds ethical standards while serving the patient's well-being. For instance, consider a terminally ill patient who requests high-dose pain medication. On one side is beneficence, relieving pain and honoring the patient's request. On the other side is nonmaleficence, the risk that the high dose could hasten death. The physician must weigh both principles carefully before making a decision. This process doesn't guarantee an easy answer, but it does provide a framework for thoughtful and responsible choices in situations where lives and dignity are on the line. 6. Professional responsibilities and competence. Responsibilities include maintaining confidentiality, gaining informed consent, providing competent, compassionate care, advocating for patients' welfare. Ethical competence means having the ability to reason ethically, reflect on dilemmas, and act with integrity. Professional responsibilities form the backbone of ethical healthcare. They represent not only what society expects from healthcare providers, but also the commitments professionals make to their patients. One of the most important duties is maintaining confidentiality. Patients must be able to trust that their private information will be safeguarded. If confidentiality is broken, even unintentionally, trust can be lost, and the therapeutic relationship damaged. This responsibility protects both the dignity of the patient and the integrity of the healthcare system. Another key responsibility is gaining informed consent. Patients have the right to know about their condition, the treatment options available, and the risks and benefits of each. Informed consent is more than a signature on a form. It is a conversation where the patient is empowered to make choices about their own care. This reflects respect for autonomy and reinforces the idea that patients are active participants, not passive recipients in their treatment. Healthcare professionals are also tasked with providing competent and compassionate care. Competence means staying current with medical knowledge, skills, and best practices to ensure that care meets professional standards. Compassion, meanwhile, humanizes care. It is the ability to connect with patients emotionally, to listen, and to respond to suffering with empathy and kindness. Together, competence and compassion ensure that treatment is both technically sound and personally meaningful. Finally, professionals must be advocates for their patients' welfare. Advocacy goes beyond the bedside. It includes speaking up when a patient's needs are not being met, ensuring they have access to resources, and sometimes challenging institutional or systemic barriers to care. Advocacy means being the patient's voice when they are too vulnerable or disadvantaged to speak for themselves. Underlying all these responsibilities is the concept of ethical competence. This is the ability to recognize ethical issues, reason through dilemmas, and act with integrity. Ethical competence requires self-reflection, courage, and the willingness to stand by moral principles, even under pressure. It ensures that healthcare providers do not simply follow rules mechanically, but truly embody the ethical standards of their profession. 7. Codes of ethics. Different fields have professional codes. Nursing, ANA, ICN, Psychology, APA, BPS, Dentistry, ADA, GDC. These organizations establish and uphold standards to protect patients and guide practice. Every healthcare profession is guided not only by general ethical principles, but also by formal codes of ethics developed by professional organizations. These codes serve as a shared standard of practice, ensuring that members of the profession act with consistency, accountability, and integrity. For example, in nursing, organizations such as the American Nurses Association, ANA, and the International Council of Nurses, ICN, outline expectations for professional conduct. Their codes emphasize patient dignity, compassion and care, and advocacy for vulnerable populations. Nurses are reminded that their duty extends beyond medical tasks to include respect for human rights and a commitment to social justice. In psychology, bodies such as the American Psychological Association, APA, and the British Psychological Society, BPS, provide ethical guidelines that focus on confidentiality, informed consent, and the responsible use of psychological knowledge. These codes stress the importance of protecting clients from harm, respecting cultural diversity, and maintaining professional boundaries. In dentistry, organizations like the American Dental Association, ADA, and the General Dental Council, GDC, in the UK, set ethical standards that require honesty, integrity, and competence. Dentists are expected to prioritize patient health, provide safe and effective treatment, and be transparent about risks and costs of care. Across all these fields, the purpose of codes of ethics is the same: to protect patients and guide practice. They provide professionals with clear expectations, ensure accountability to the public, and strengthen trust in the healthcare system. By adhering to these codes, healthcare providers not only maintain their professional reputation, but also demonstrate a commitment to the well-being and dignity of every patient. The 8. Case examples, discussion starters. To bring this alive, consider these scenarios. A 14-year-old refuses painful treatment, but the parents want it. Autonomy versus beneficence. A hospital has 1 dose of a drug and 3 patients. Justice. A patient in pain asks for high-risk pain medication. Beneficence versus nonmaleficence. A family overrides a patient's DNR order. Autonomy versus family wishes. Ethics becomes most meaningful when applied to real-life dilemmas. Here are a few case examples that bring the 4 core principles into focus. Example 1. A 14-year-old refuses painful treatment, but the parents want it. This situation pits autonomy against beneficence. While the parents want to act in what they believe is the child's best interest, the young patient expresses their own wishes to refuse treatment. The ethical tension lies in whether the adolescent has sufficient maturity to exercise autonomy, or whether beneficence requires overriding their decision to protect their health. This raises broader questions about children's rights, parental authority, and professional responsibilities. Example 2. A hospital has only one dose of a life-saving drug, but 3 patients need it. This is a clear justice issue. How should the single dose be distributed? Should priority go to the patient most likely to survive, the one who is sickest, or the one with dependence? No matter which choice is made, some patients will be left without treatment. Justice demands that decisions be made fairly, without bias or favoritism, and with transparent reasoning. Example 3. A patient in severe pain asks for high-risk pain medication. Here, beneficence and non-maleficence are in tension. On one hand, the physician wants to relieve suffering by granting the request. On the other hand, prescribing a high-risk medication might cause harm, such as dependency or even death. The ethical challenge is to find a balance, perhaps offering alternatives, adjusting dosage, or closely monitoring use. Example 4. A family overrides a patient's do not resuscitate (DNR) order. This conflict highlights the principle of autonomy versus family wishes. The patient has clearly stated they do not want resuscitation, but in the heat of crisis, the family insists on life-saving measures. Should healthcare providers honor the patient's expressed choice or give in to the family's demand? Upholding autonomy often means respecting the patient's voice, even when loved ones struggle to accept it. In the end, ethics in healthcare is far more than an abstract set of ideas. It is about the practical application of principles, virtues, and responsibilities in real-world situations, moments where decisions can profoundly shape the lives of patients and their families. Every choice, from prescribing medication to respecting a patient's refusal of treatment, carries moral weight. The 4 central principles of bioethics offer a compass in this complex landscape. Beneficence reminds professionals to always act in ways that promote the good of the patient, striving to heal, comfort, and enhance well-being. Non-maleficence cautions against actions that could cause unnecessary harm, requiring providers to weigh risks carefully and avoid interventions that may do more damage than good. Autonomy emphasizes the patient's right to make their own informed decisions, recognizing each individual's dignity and freedom to choose, even when those choices challenge medical advice. Finally, justice calls for fairness in access, resources, and treatment, ensuring that no person is excluded or disadvantaged simply because of who they are or where they come from. Yet, principles alone are not enough. Ethical healthcare depends equally on moral character, such as compassion, honesty, and empathy, which humanize professional practice. It is reinforced by professional codes of ethics, which provide structure, accountability, and shared standards across fields like nursing, psychology, and dentistry. Together, principles, character, and codes weave a strong ethical framework that guides decision-making in moments of uncertainty and tension. When healthcare professionals combine these elements, principles to direct them, virtues to shape them, responsibilities to anchor them, and codes to guide them, they are able to deliver care that is not only technically competent, but also ethical, compassionate, and just. This is the heart of healthcare ethics: to see patients not as cases, but as people, and to act always in ways that protect dignity, foster trust, and uphold the highest moral commitments of the profession.